I think this year there are a lot of stuff happening in lymphoma. CAR-T, definitely there is more information coming out on CAR-T, especially in mantle cell lymphoma. There was also a CAR-T presented on the early high-risk diffuse large B-cell lymphoma patients. So that is also very interesting to see these patients who got chemoimmunotherapy for 2 cycles and had their PET scan done. And if they are dual score 4 or 5, they went on to get CAR T cell therapy. And that seems also, that's another interesting area to see. So that data also looks some promising results from that. So mostly the CAR T looks like it's moving more towards in the frontline setting now, rather than in the relapse setting. So that's interesting. There was another trial presented on Mantle cell, the liso-cel CAR T, and that also shows promising results, good response rate. The other thing, I think the other big one is the bispecific antibodies. So there are a lot of 3 different studies that was presented yesterday, looking at 3 different bispecific antibodies. And that is CD3 and CD20 bispecific antibodies. So that looks very interesting also, because those trials did include post-CAR T-cell therapy patients. So right now, one of the questions is, how do we treat these post-CAR T-cell therapy if they relapse after CAR T? So response rate in those patients was very encouraging to see. So that's very exciting to see how those 3 bispecific, all the different bispecific antibodies we have will move forward in the treatment of diffuse large B-cell lymphoma.